Overall, in general, looking at the data available, over 18,000 implants have been utilized in the United States. There's a lot of data, and I'll go over some of the peer-reviewed publications. Overall, the IDE data, the randomized controlled trial, 52 patients were randomized to the VariLift. And here in general, after 2 years, there was 94% with trabecular bridging bone indicative of solid fusion. 13.4 was the average disc height, posterior disc height being 9.2, which really is indicative of ongoing maintenance of lordosis and significant improvement in the ODIs. A composite of 7 peer-reviewed VariLift publications are also indicated on the slide. The overall sample size was 855. 611 were 1-level standalone, 237 were 2-level standalone. Follow-up duration was anywhere from 9 months to 5 years, and the mean fusion proportion ranges from 92.3 to 100%, with overall 94.5% fusion reported. Several such studies can be broken out. This is from ATIA, presented at the International Symposium Swiss Spine Institute in June of 2002. A total of 131 standalone patients. There were 26 with pedicle screws and VariLift. Had undergone 123 1-level and 34 2-level fusions. Radiographic follow-up at 1 to 5 years demonstrated a 95% overall fusion versus a 1.3% revision rate. Here's another study with Doria and et al. Published in the Journal of Orthopedic Traumatology. This is an instrumented posterior fusion and degenerative multi-operated spine. Again, a total of 37 patients, 30 were standalone, 7 did include pedicle screws. Radiographic follow-up at 3 years demonstrated 100% fusion with significant raised criteria of bridging bone and lack of subsidence or lack of migration. Dr. Neely presented data in the International Journal of Spine Surgery in 2016. Again, 470 patients overall, 298 1-level, 172 2-level fusions. Follow-up from 9 months on from that point, 94% of patients were found to be fused. 18 patients, or 4%, did require reoperation. 16 for adjacent segment degeneration, 1 at the index level for worsening of symptoms after fall, and 1 for a deep wound infection. And subsidence of greater than 3 millimeters was found in 2% of the levels treated. Another study looking at 25% standalone fusions, 18 1-levels, 7 2-level. Again, radiographic follow-up was at 12 months and 92.3% fusion with no revisions in this particular study. And this is a study looking at in the Journal of Spine by Wofield et al. Looked at 9 standalone patients, but these were treated for for symptomatic adjacent segment degeneration at 1 level. A radiographic follow-up for 24 months. Fusion was at 346 days, average 100%. Significant improvement in BAS went from 9.3 to 2.4. So these studies do indicate the clinical efficacy and overall safety and maintenance and durability of the implant. This is a typical image that can be seen post-op surgery at 6 months. So the image does demonstrate the lordosis, the expansion, the engagement of the implants, and overall stability of the implant at 6 months. Here are some typical post-op images looking at 1-year follow-up, and where again, stability, maintenance of lordosis, lack of subsidence is clearly demonstrated with the device in a standalone fashion. And the CT scan clearly demonstrating a bridging bone between the vertebral bodies through the implant itself.